Good morning, everyone. Thank you so much for joining us here today. I'm Candace Brake with the Greater Owensboro Chamber of Commerce, and we are delighted this morning to be able to bring to you two of our community's leaders with regard to the Healthy at Work initiative and getting businesses ready to go and ready to reopen. Today, we have Dr. Francis DuFrayne, the Chief Medical Officer at Owensboro Health, and Clay Horton, the Executive Director of the Green River District Health Department. Dr. DuFrayne and Mr. Horton have both been key leaders in our community throughout the past weeks to get us through this and to get us ready to go. We're very optimistic about the future, and we're so delighted that we have leaders of your magnitude, Dr. DuFrayne and Mr. Horton, that have been here throughout this time. And thank you so much today for giving us your time to help our businesses and nonprofits reopen in the correct way and do things which is best for the safety of their customers and employees. Welcome.
Thank you, Candace. I really appreciate the opportunity to be able to come and help our community reopen. We are right now in the process of reopening our hospital. And just like the governor, we're taking this in a phased approach. About every 2 weeks or so, we're adding in more opportunity for people to return. And I think as our businesses do the same thing, it'll be a much safer and healthier opening. And I think it'll be really secure for our community. So I think I can address some of the things, particularly for our small businesses as they're opening. I think the best thing to do is to really continue to follow the guidelines that we've been talking about for a while. And that is physical distancing, hand washing, respiratory hygiene. If you have to cough into a tissue or your hand, and then no matter what, wash your hands frequently. Every time you think about it, wash your hands. And then there are several opportunities for businesses to protect their employees and their customers even more. A number of businesses that I've been to since this has started, they've all installed plexiglass between their team members and their customers. We have done that here at the hospital at our reception desk. We put up plexiglass. In other areas we've had to protect our team members. Everybody at the hospital wears a mask. But the only time you have to wear a mask here is if you are in your own private office with your door shut. You can take your mask off, but don't have meetings in your office. Have meetings elsewhere. You shouldn't really have meetings anyway. As much as possible, you should do it by teleconferencing. And just like we're doing right now, we are becoming experts in teleconferencing, Zoom, Google, you name it. I think I've been on every social media site that I can think of in the last 6 weeks. So anyway, good hygiene, clean your place of work frequently. If you have counters, you should wipe them down. You should try and wipe them down in between customers. I see some businesses where they have their card swipe machine set off separately so that they can be not exposing their team members. And then in between each card swipe, they're wiping the machine down, not spraying it. That will actually damage the machine, but just with a Clorox wipe or one of the other wipes that you can buy, they will clean it in between. With regards to things like screening, you should teach your employees how to screen, and you can screen them yourselves. For smaller businesses, it's going to be much harder to get things like the infrared thermometers to check it. So we recommend to check every employee, every person, check their temperature once a day, typically in the morning. If it goes above 100.5, then you need to call your employer and let them know that. If you are checking them at work and they're at 100.5 or greater, then if you do not have an on-site occupational nurse or occupational setting, you need to send the employee home. So the questions that we typically ask really follow the CDC guideline. And those questions are, have you had a fever? Do you have a cough? Do you have shortness of breath or difficulty breathing? Do you have chills? Do you have muscle aches or shaking? Shaking, chills, muscle pains, headaches, sore throat. And next one is a little unusual, but we're seeing it more and more, and that is, do you have a loss of taste or smell? We think the virus is affecting those nerves, and some people, the first symptoms they get are Oh, for the last 2 days, I can't taste or smell anything. So those are things. So if you answer yes to any of those questions, or you have the temperature, you should really send the patient, the employee home, have them contacted by phone their healthcare provider, and then they'll know how to go from there. So those are really kind of the common um, questions that I get as to how do we get back to work, how do we do things, how do we do things in a consistent way. So thank you.
So thank you, Candace, for putting this together. I think it's a very important topic. It's one that we've had a lot of focus on the last several days, or really last couple of weeks here at the health department. And that is even in context of the number of contact tracing cases that we are working and actively responding to all of the cases of COVID-19 that we've seen in our community. So I think this is a very important next step. I know that the sacrifice that a lot of people in the community have made with our pause that we've had to take over the last number of weeks. But as we approach this, I really like to have to challenge everyone in the community, and especially our business leaders, to figure out a way to make this work. It's not going to be the way it was before. If it is like it was before, we know that we're going to see an increase in COVID-19 cases. So the state has done a very good job with their Healthy at Work program. And if you have not already done it, I encourage you to go to healthyatwork.ky.gov. There's a wealth of information there. We get lots and lots of questions here at the health department about the rules and the guidelines in terms of reopening businesses and how to comply with those. There's some great industry-specific guidance at that website that will answer a lot of those questions. We find that a lot of our businesses are very unique, and oftentimes the specific industry guideline or your business doesn't fit into any one particular sector. So here at the health department, we're happy to help you work through some of that. But what we do ask is that you be patient. This is a thought-out, science-based approach. This phased reopening is meant to be deliberate, and it's meant to be gradual. So we do ask that you be patient and that you try to approach this in phases. Otherwise, we're not going to be successful at it. The other thing that I've challenged business leaders to look at in terms of these healthy work guidelines or 10 rules that the state has put out is don't think of these as rules and regulations. Think of these as your playbook or your strategy for being successful in this environment. We have seen firsthand, there have been a number of businesses that were deemed life essential that never closed during our pause. And we've seen firsthand those that were successful in controlling the spread of COVID-19 in their operations and those that haven't. And it can spread, and it can get you in a situation where it affects a large percentage of your workforce very quickly. So if you've been successful these last several weeks teleworking and being able to telecommute, continue to do that as to the greatest extent possible. You should limit face-to-face meetings. Dr. DuFrayne said we've all become experts at these multiple platforms, Google Meet and GoToMeeting and Zoom. In a lot of ways, we have found them, in my work anyway, that they're even more efficient, and we should continue to use these tools and this technology. We want you to have a phased return to work. Opening day is probably not going to be at 100%. And in fact, in a lot of our industry-specific guidance, there are specific thresholds and levels of capacity that are mentioned. Please adhere to those. Dr. DuFrayne already talked about symptom and temperature checks. Those are very important. It's also important to know what to do when someone doesn't pass that screening. That's what the state guidance is referring to, a testing plan. So we have great resources in our community with Owensboro Health, other primary care providers that are offering COVID-19 testing. The health department is now making available COVID-19 testing for folks that can't get it through another avenue. You can sign up for that at our website, healthdepartment.org. You need to continue to make special accommodations for those in our communities that are the most vulnerable. The individuals that are over the age of 65 have pre-existing health conditions that are more susceptible to the extreme effects of COVID-19, should not return to work immediately, or should be able to telework where they're not having to interact with people in close and prolonged settings. So because we want to protect them. Closing common areas, things like waiting areas, break rooms, to the greatest extent possible. Obviously, in some situations you can't completely close them, but figuring out how you adapt those spaces to physical distancing so that we're avoiding all of these close and prolonged contacts. That's really the key to this. When we have a case of COVID-19 in our workforce or with someone that we interact with in business, if we've limited that contact, we know that there's a much less likelihood of other people becoming infected, and our control measures are not as restrictive at that point. We're not looking at putting people off work because of quarantine or having folks isolate at home. So universal masking is a big part of that. We're receiving a lot of questions about masking right now. So everyone that is not in their own personal enclosed space, like if you're in your office by yourself, obviously you don't have to wear a mask, but as you get up and walk into other parts of your business or your organization, you should have a mask on. That would include, even if customers are not in the store at the present. We've received that question, that do our employees have to wear masks even when customers are not there? If your employees are interacting with each other, then absolutely, they should wear a mask universally. It doesn't have to be an N95 respirator. It can be a cloth mask or these disposable 3-ply masks. But those are absolutely necessary in terms of capturing those respiratory droplets and reducing the risk of that when we're around others. We've received the question that, this phased reopening has set deadlines. So for example, if your sector is scheduled to reopen on May 11th, which is Monday, and you don't feel that you're ready, then by all means, you don't have to reopen. Continue to work towards these rules, or as I keep saying, a strategy. Everyone that I'm close to and know well that works in business thinks of themselves as kind of being very proficient at figuring out logistical solutions to problems. COVID-19 is all of our problem right now, and figuring out how to successfully manage and operate in this environment is not only going to protect you and your workforce and our community, it's what's going to make your business successful. Your customers need to know that they have a confidence that they can visit with you, do business with you, and be in a safe environment. We get there are some specific benchmarks or dates for the phased reopening. I think most of you know those, but May 11th, manufacturing, distribution, supply chain businesses, construction, vehicle and vehicle dealerships, office-based businesses at 50%, horse racing with no fans, pet care, grooming and boarding, and photography. Retail businesses and houses of worship are scheduled to phase in on May 20th. Restaurants with a limited inside seating capacity on May 22nd. May 25th is for barbershops, salons, and similar businesses. That is key on my calendar right now. I'm looking very forward to getting a haircut. June 1st is movie theaters and fitness centers. We're getting lots and lots of questions about fitness centers, exercise classes. Specific guidance will be coming. We just ask all of those businesses to continue with what you've been doing with your virtual classes until June 1st and look for more specific guidance on how you can phase back in just a few short weeks. Campgrounds and then childcare is also a big one coming on June 15th. We know that creates difficulties if you can't have childcare with returning to work, but it's also a high potential contact area, and it's one that's very important that we get right. So we need to take our time and get that right. Again, I would urge all of you to visit healthyatwork.ky.gov. They have a very good frequently asked questions page. If you go there and you read that material, look through the guidance, still can't find the answer that you're looking for, or have additional questions, always feel free to call us here at the Green River District Health Department at 270-686-7747. And we have staff that are immersed in this, that are working with businesses and working with the community every day. They can take those calls. Sometimes we have to research them a little bit more, but we're always ready to assist and try to figure this out as we all go along, because we're all doing business differently than we did a few months ago. But we're up to the challenge. I know our business community is up to the challenge, and I really appreciate all the support that we've gotten here, and we continue to look forward to working with all of you. So thank you, Candace, again for putting this on and giving us the opportunity to talk with our partners.
Thank you, Clay and Dr. DuFrayne. And as we said earlier, we will have, as the reopening guidelines come out for different sectors, we'll have those on our website. And if any of our business leaders happen to access those and have questions, as Mr. Horton said, you are able to contact them. We can connect you with them. But just to underscore the collaboration that these two organizations have done over the past few weeks, we are so proud as a community and really confident in our leadership at OH and at the health department. And you know, these kind of collaborations aren't just things that happen. So thank you both for your leadership. Thank you to Owensboro Health and Clay to the health department. Thank you so much. That's just one of the things that lets us go to bed at night and know that we've got people up on the wall watching out for us, and it means more than we can say. So thank you. And thank you to all the people that joined us today. Do know that this will be on our website if you have something you need to cross-reference or go back to and review. And we'll be keeping you in the loop on decisions as they are made. And as we move forward, we'll see you soon.